Okay, we have them queuing up, John. I'll let you know when when they stop loading.
Okay.
That means there's more than 5?
Well, I'm up to 13 right now.
All right.
It's so noisy here. Hang on.
Were there a lot of issues in the town with the power last night because of all the high winds? No?
No,
That's
in fact,
crazy.
I didn't get any notifications at all, interestingly enough.
Yeah, that's good.
We're sitting at 16 right now.
Hmm.
So if you'd like to give it just a couple minutes, we can see if anyone else queues up. Sorry, that was the police chief I'm giggling at. Still coming in.
Okay.
Good turnout, actually.
Sorry, guys, I'm trying to do too many things here at once and it doesn't work out well. We're up to 18, John. It hasn't increased for a couple, so it's up to you.
Yeah, out of respect for people's time, I'd say we get going.
We are good to go.
Excellent. Thank you, Chief. Welcome, everybody. My name is John Coder. I'm the Town Administrator in Northborough. And with me today, I've got the Fire Chief, David Parente, who is also our emergency director. We have Kristen Black, our health agent, and our special guest today is Karen Chapman, who is the president and CEO of the Quarter 9 Chamber of Commerce. We also have just been joined by Chief Bill Liver. And the purpose of today's meeting is to do a workshop for the businesses in Northborough. A lot of things have been happening recently. You've seen a lot of new orders and advisories that have come out, and we're trying to put together just a brief package of information for our local businesses so they know what's happening, what they should be doing, and where they can seek additional information. So the goal of our workshop today is really threefold. First, to provide you with an update on what's happening and changing so that you can make sure that you're doing everything appropriately to stay open. The second is to share resources. So Kristen Black is in her presentation, has a lot of links to various resources that you can take up after the presentation. By the way, her presentation is available on the town's COVID-19 website. It's on the left-hand side. It'll be the first link. So provide update, share resources. And last but not least, we want to make sure that our local businesses know who they can go to for additional information. So we want to make sure that we're making a personal connection, specifically now that Kristen Black has been with us as our new health agent for about a month now. She's still getting settled in. She's doing a great job. She's done an excellent job getting information out and compiling resources. So we want to make sure that our local businesses know what those resources are, where they can find them, and who to call should they have any questions. So in terms of the format today, we're going to go through presentations. Kristen's going to do a presentation, and as well as Karen. And then throughout their presentation, if you have any questions at any point using the Q&A function, please feel free to submit any comments or questions that you have. At the end, we're going to hold some time to go through those questions. And we'll also have an opportunity for those that are on live to ask a question by using the raise your hand feature. Last thing I want to remind everybody is that we are recording this, and so anything you say here will be recorded, and the goal is for those folks who weren't able to attend, or those who attended and wanted to review the information again. We're going to make the whole presentation available on our website, along with the presentation, which is already up on the website. So again, any questions you ask, any comments that you make, if you come on and raise your hand, it's all going to be recorded. So people should be aware of that on the front end. So with that, we want to get into the meat of the presentation. I'm going to turn it over to Kristen Black, our health agent, and Kristen's going to run through her presentation. Again, if questions pop up in your mind as we go through this information, feel free to put it in through the Q&A function, and we will get to those questions at the end when we have a little bit of time. So with that, I'm going to turn it over to Kristen.
Great. Thank you, John, for that great introduction. I'm just going to pull up our presentation here again. As our town administrator, John, mentioned, you can find these slides are available on the town's website. And as I work through this presentation, anything that you're going to see green is a hyperlink. So I'm trying to link to the original sources of information. So I first want to say, first and foremost, I do not have a crystal ball. So we're going to do our best to work through it. So today I'll really be talking about the rules, new orders, protocols, guidance, et cetera, for businesses that are current as of this morning. Things are rapidly evolving, and we're hopefully going to use this as a resource to connect all of you and let you know what's happening now, and help to educate you on how to stay up to date as things evolve. So just here's a quick outline of the workshop today. I'm going to talk a little bit about the role of the local Board of Health. We're going to talk about Massachusetts reopening standards for businesses. So this is what all of you have been following as businesses. This reopening standards website is broken into 3 key sections: the general business guidance, sector-specific protocols and best practices, and then this additional guidance section. So I'll walk you through those 3 main components. I'll also talk about the recent state COVID-19 orders and advisories, talk about the Northborough's COVID-19 webpage, some recent updates we made to that. I'll also talk about what current risk status we are in Northborough and how that relates to our phase and step of the reopening plan. And then I'll walk you through some frequently asked questions we received at the health department. Then I'm going to hand it over to Karen Chapman, again, our Quarter 9 495 Chamber of Commerce president, for a brief presentation. And then again, we'll open it up to a question and answer sessions. So as John mentioned, questions may be submitted in the Q&A box, and you just type your question in and hit send. Let's see. Okay, so again, let's see, this webinar is being recorded. So let's talk about the role of the local Board of Health. So in the town of Northborough, we have a 5-member elected board, and this has been in place for a very long time. Local boards of health in Massachusetts are required by state and local laws to perform many critical duties related to the protection of public health. So these duties have been pretty static over time. They cover a wide range of public health control and prevention activities, including disease surveillance, the promotion of sanitary conditions in housing, recreational facilities, food establishment, elimination of nuisances, the protection of the environment, and numerous other health responsibilities. You might always think of the Board of Health as food, septic, and wells, but we do a lot more, and we have been responsible for disease surveillance, including, measles outbreaks, hepatitis, tick-borne diseases, and we do all of that in partnership with our contract with SAM and VNA, and they provide nursing services to the town of Northborough. We team up with the Department of Public Health on investigating infectious diseases, and in the case of COVID-19, performing contact tracing. And recently the state has also brought in another third party, the Community Tracing Collaborative, also known as CTC, and they assist local boards of health and DPH with contact tracing. And again, we as a local board of health have the authority to issue our own orders and regulations, but please note the town of Northborough has not done so. So we're going to defer through this presentation. Everything is related to state orders and regulations. So a little bit more on the Board of Health. During the pandemic, we have been tasked with non-compliance investigations as well as enforcement. So if there's complaints out there in the public, there's a state website that pushes all complainants to contact their local Board of Health or the Department of Labor Standards to file a complaint. So that state in green, again, is our first hyperlink there. We'll take you to that state website where you can either send an email, call a phone number, or you can submit an online form. So again, the enforcement end of things also as well has been tasked to local public health and in partnership with the Department of Public Health, and then any authorized agents, which could include state municipal police or any other agency the governor has formally designated at the request of the DPH can enforce these orders. And lastly, there are fines associated with many of the new orders. They can be, layered or per occurrence over time, and those are all outlined in the specific orders. So here, all of you should be familiar with the Reopening Massachusetts website. You can just Google Reopening Massachusetts and this should pop up. So I recommend if you haven't already visited this site, please do so. There's a hyperlink at the bottom. And this is these key sections that are on this major, the reopening webpage. So first you can just learn about the reopening and why it's taking place, when it started. And we'll be covering these middle three categories. So I'm going to be going over the general business guidance, the sector specific protocols and best practices, and the additional guidance documents. So under general business guidance, so this is about the self-certification you hear about. And this self-certification is required for all businesses to reopen. So they have to meet these standards before reopening. So many businesses did this, back in April, May. And so there is a template on the website. Again, here's a hyperlink. And so you can just use that basic template to satisfy the requirements for the written control plan. There's also a compliance attestation poster that you'll see in the next slide. I have a screenshot, and all businesses that are inviting employees or the public in should have that poster, sign, print, and post it in a conspicuous area. So somewhere where workers and visitors can see it. So maybe at the glass at an entry door. And there's also employer and worker posters available under this general business guidance that businesses can choose to print and display on premise to help remind staff about the basics of social hygiene, social distancing, and cleaning and disinfecting. So then, another component here under this general business guidance is these mandatory workplace safety standards. So these new standards universally apply to all businesses. So whether you're a golf course or a farm, this is going to be the same set of standards for all businesses. And there's 4 main sections to it. It's social hygiene, social distancing, hygiene protocols, staffing and operations, and cleaning and disinfecting. And so on the right of the screen, you can see the attestation poster that all employers must sign and post. And these 4 boxes are broken into these 4 sections. So I think you've all heard plenty about social distancing and hygiene protocols, so I'll be skipping over those today. Instead, the next few slides are going to focus on the staffing and operations section and cleaning and disinfecting. So again, with staffing and operations, under the mandatory workplace safety standards, you are required to provide training for all your workers, and it must include at least the following 4 topics: signs and symptoms of COVID-19, risk of asymptomatic spread of COVID-19, employee and employer requirements under COVID-19 workplace safety regulations, including any sector specific standard. So for example, if you're a restaurant, you're responsible for training and educating your staff on any requirements that are specific to a restaurant business. And they also, the state wants you to inform your employees or your workers of the anti-retaliation protections that are available under 454 CMR 31. The training that you do should be documented and provided at no cost to the employee during working hours. And employees who are displaying COVID-19 symptoms should know that they do not return to work. You should also establish a plan for employees getting ill from COVID at work and a return to work plan. And employers should take measures to ensure their employees comply with all state issues rules concerning out-of-state travel for any employer paid or reimbursed travel. And I'll talk about the travel order later on in the presentation. So cleaning and disinfecting, this sounds so basic, but it can be a little difficult for some businesses. So first, it's important you establish and you maintain cleaning protocols specific to your business. So when an active employee, for example, is diagnosed with COVID-19, you should have a process for cleaning and disinfecting. And with all of the cleaning and disinfecting, we recommend you refer to the sector-specific guidelines and details, and I'll talk about those later. Disinfection of all common surfaces must take place at intervals that are appropriate to your said workplace. So these, again, this text is taken straight from the mandatory workplace safety standards. And we're going to recommend you would look to your sector-specific guidelines for more on cleaning and disinfecting. So I love this slide from CDC. It just says that about 1 in 3 adults use chemicals or disinfectants unsafely while trying to protect against COVID-19. So while we all try to think, oh, cleaning and disinfecting, I've got it, it's simple, just be aware that there's some common mistakes. It's really important anyone using these products is reading the instructions, they're wearing the appropriate protective gear or PPE, and that they're not mixing chemicals. So there's a little bit of a difference here with cleaning and disinfecting. So cleaning, it's important to note that's about really using soap and water and physically removing germs from surfaces. So think of cleaning your dishes, right? And that process doesn't necessarily kill germs. It does remove them and it does lower their number and reduce the risk of spreading infection. But disinfecting is really your second step. And that's when you're in fact using a product that's known to kill germs on surfaces or objects. And sanitizing, well, that falls somewhere in between the two. And that's about reducing the number of germs, but not necessarily killing them. Okay, so disinfecting, the devil is in the details. So remember that, think of all the D's in that title here. It's important that you really look to the nitty gritty here on disinfecting. So you're gonna clean the area, soap and water, or another detergent if it's dirty, and then you're gonna go on to your disinfectant. So EPA has produced a great website. It's extremely detailed. It's called EPA's List N for disinfectants for coronavirus 19. And you can go to that website and determine if the product you have as a disinfectant is approved for COVID-19 or proven effective, and also if it's appropriate for the type of surface. So it's important to note where you're using this product. If it's a food contact surface, like a cutting board or knives or plates, you want to make sure that you're using the right product. So you're going to follow the instructions on the label to ensure safe and effective use of the product, and realize that many products are going to have a specific period of time, also known as a contact time, in which the product must stay on the surface. So it's really important to read those details on your disinfectant. I've seen contact times can be as short as 30 seconds and as long as 10 to 15 minutes. So it's really important to find a product that works for your business in the time period you have to disinfect. Again, follow all precautions when you're using these products, good ventilation, and make sure to safely store this product when done. We're seeing a lot of new products out there. You don't want to take a product that's toxic for children and it says, you know, don't leave near children, leave it on the floor of a shared bathroom where a toddler could be. So it's important to safely store your products and to check expiration dates. So some products may expire. Bleach, for example, I'll get to that next. It does have an expiration date. And also, if you are taking a product and mixing it, realize that some products, once mixed, are going to have a shelf life. And I've seen shelf lives of everything from a day to a month once you've mixed it. So again, you know, you can always check with the manufacturer. And if you're not sure about the concentration in the food industry, people are really familiar. You can get these little concentration test strips. They look like your pool, you know, test strips, and make sure they're appropriate for the product you're using. And especially if anyone is using those fancy defoggers or electrostatic dispensing guns, you know, when you see the people in the suit spraying that product, you want to make sure the product you're putting in that device is approved for it and that your staff are properly trained in using all the proper PPE. So again, if you're not sure, contact the manufacturer of both the product and the piece of equipment. So here's a screenshot on the right of EPA's List N where you can check on your disinfectant. So visit that website. And again, any products they've listed here, they expect them to kill the SARS-CoV-2, which causes the illness known as COVID-19 when you're using the label directions. So again, there's several different ways to search. You can enter, you know, keywords, you can enter the number of the EPA registration, but that website's great. It's going to talk you through it. And importantly, you can even filter by categories. So if you're in the food industry or daycare, schools, it's important that if you're using this on toys or any food services, you know, you want to pick the right product. Some may allow for food contact, but they require you to do a rinse afterwards. So find the product that works for you. So this is a basic example, right? We all think cleaning and disinfecting, this is so simple. I know what a disinfectant is. You know, first it always comes to mind, Lysol. Okay, so let's just go through this example very quickly. Here's Lysol disinfectant spray, crisp linen. It's found on the EPA's registration list. It is, you know, tested against, you know, the virus that causes COVID-19. It can be used on hard, non-porous surfaces. That makes sense. You wouldn't spray it all over a couch, for example. It does recommend that you would pre-clean surfaces prior to use. So if you had a lot of buildup or dirt, it's important you clean that first. Basic directions: hold the can 6 to 8 inches from the surface. Okay, got that. You're going to spray it 3 to 4 seconds until it's covered with a mist. All right, that's, again, this is all straight off their website. But then note, these are the key things that are highlighted here. Rinse toys and food contact surfaces with drinking water or potable water after use. So you don't want to be spraying this Lysol spray all over the countertop right next to where you have silverware, for example. It's not safe. And it's another key thing. I talked about contact time on the prior slide or 2 slides back. Services for this particular product, in order to be effective against COVID-19, it must remain wet. So the surface has to be wet for 3 minutes and then allowed to air dry. So I think of my own use of products in my bathroom as I'm quickly cleaning up in the bathroom area, and I think most of the time we all do the spray and wipe. And so if that was your approach with this product, it would not necessarily be effective. So it's important to know how to use the product to make sure it's safe. I have a couple slides here on bleach as a disinfectant. We all saw early on in the pandemic, people couldn't gain access to disinfectants, and you're calling companies and they're out of the product you want. This is just a reminder that bleach is readily available. It's inexpensive. It is effective against coronaviruses. It must be diluted, but it could be a great alternative for your business. It's important to check the expiration on the bleach and make sure that you realize that dilution is only going to be good for a set time. And on average, they recommend 24 hours. And you can buy test strips, so you can make sure concentration is adequate. This is a long slide. I'm not going to get into the details. CDC does have very detailed recommendations for the use of bleach for your facility. So that slide is in our slide deck for your future reference. So I'm going to move on now to sector-specific protocols and best practices. So this is a screenshot straight off the state's reopening website. It has a list of all the businesses that have their own special guidelines. Okay, so it's arcades, etc. We have close contact personal services. Please note that includes like massage or hair salons. So some of the guidance we saw early on has been lumped. So for example, a barbershop, now you're going to find those rules under close contact personal services. And if you're not sure where you fall, try opening these documents. You can read in the beginning and it will sort of give you a little summary of what businesses the individual guidance would be applicable to. So we have drive-in movie theaters, driving and flight schools, fitness centers and health clubs, golf facilities, on and on here. So office spaces, restaurants, retail businesses. So these are all the sector-specific protocols that are available on the state's website and that businesses would need to follow. So it's your responsibility as a business to be aware of the appropriate protocols and best practices and to follow them. And then this next section that you'll find on the state's reopening website is just called additional guidance. A lot of great information that's sort of hidden here. And so I want you to realize there's a whole section on recreation that's going to break it down into youth and amateur sports and other types of activities. There's also a reopening health and human services, which is going to be more related to doctors' offices. There's links here to the higher ed guidance, child care guidance, day camp. So again, so many sets of information and guidance, and we really recommend that you would work your way through these documents. And I'm just gonna go back here for 1 minute. I just want you guys to realize here on this screen with these sector specific protocols, there's ones here called indoor and outdoor events. It's on the left. And so that event guidance, I'm going to talk about a little bit more in this presentation. So that may be, you may be a restaurant that's holding a bridal shower. So for example, a restaurant could fall under both this restaurant guidance and the indoor and outdoor event. So realize there's going to be some overlap, but this is where we're going to find the indoor and outdoor events is under our sector specific protocols and best practices. So this is the mind-blowing, right, where more than one set of standards may apply to your business. So while you may have thought, I printed the right document, it's on my desk, I've worked so hard, I know it inside and out, just realize that more than one of these documents could apply. So you can fall under more than one Read your detailed guidance. Many of the guidance documents will actually have hyperlinks and they'll take you to the other guidance documents. So it should be spelled out pretty well in the sector specific guidelines. So here's a couple examples. One, a fitness center is going to hold adult classes and they have an occasional birthday party or two. So the fitness center is going to fall under the fitness center and health club sector specific guidelines. The adult class, let's say a yoga class, would fall under the safety standards for youth and adult amateur sports. And that's currently in phase 3, step 2. And then if you were to host a birthday party, you want to refer to the indoor and outdoor events guidance. Another example may be a motel as a small retail shop and a pool. So 3 guidance docs I can think of would apply. It would be the motel falls under the operator of lodging, sector specific guidance. The little retail shop is going to fall under the retail business guidance. And the pools has its own set of rules, and that's under the public and semi-public pool safety standards guidance. And now let's move on. New state orders and advisories. A lot has happened in the last few weeks. In particular, several new orders, stay-at-home advisory, et cetera, became effective on Friday, November 6th. So you may have all seen that in the news. So again, I'm going to cover the stay-at-home advisory, the early closure of business and activities, that's order number 53, the revised gathering order, order number 54, the revised face covering order, order number 55. I just want to point out that the safety standards for youth and adult amateur sports and activities had many updates to that document. Even I think the 11/7, there might even be a more recent date there. So I won't cover the sports guidance here. I don't think that applies to the whole group, but just realize there were some pretty substantial changes, like masks required at all times during active play for moderate and high risk sports, etc. So make sure you take a look if you're in that field. And then I'll talk a little bit about just some quick updates to our travel order where some more red states were added. So here's our stay-at-home advisory. I think, I guess in the world of COVID, this is old news right now, but beginning on Friday, November 6th, all Massachusetts residents were advised to stay home between the hours of 10 p.m. and 5 a.m. And residents may only leave their home for essential needs. That would be going to work, seeking emergency medical care, going to a pharmacy, receiving a delivery, going to school, going to the grocery store, or picking up takeout food. So an important note was just not to host gatherings during this hour. The idea at 10 p.m. everybody's home and we're going to be limiting those gatherings. So we'll move on to the early closure of businesses and activities. So this is COVID order number 13, and it requires the early closure of certain businesses and activities each night, probably at 9:30. You may keep businesses open for employees as long as the customer and the public are not admitted. I'll cover a couple details on this, but overall, the businesses include restaurants, liquor store, adult use marijuana, which wouldn't apply in town, indoor and outdoor events, theaters or movie theaters, youth and amateur sports activities, golf facilities, recreational boating, outdoor recreational experiences, driving and flight schools, close contact personal services like hair salons, nail salons, gyms, fitness centers, health clubs, indoor, outdoor pools, and museums. And there's a few more listed on there, but you can read those yourself. So it's important to note that this early closure of businesses does not apply to retail. And we thought before, a lot of people have stuck in their head this essential businesses. Remember when the shutdown happened in the spring, essential businesses were allowed to stay open. We've really totally removed or stopped using the essential businesses language. So you can't say, well, I think I'm essential. That's what we were before. So for retail to stay open, you don't necessarily need to be a prior essential business. So for retail businesses, they can sell anything in person, food, gas, clothes, furniture, hardware, candles after that 9:30 limit, except for alcohol or cannabis. And that's a retail. I'm not saying a restaurant. So it's a little different. So again, related to restaurants, I don't know how many restaurants we have on this call right now. There are some details there for restaurants to consider. So the 9:30 clock, you should really have anybody seated and eat, orders taken and served by 9:30. So no one should be coming in the door after 9:30 or even a few minutes before, because the key thing is they need to be seated. They would need to exit the premises by 10 p.m., but if they were finishing their meal, they don't have to get kicked out at 9:30 on the dot. But it's very important to note that you cannot order additional food or beverages after 9:30. And again, you know, employees would be able to stay there beyond that period, but it's about closure to the public. And so I'll leave that slide. You'll be able to, restaurants can refer to that for future reference and more details. Orally closure or COVID-19 order number 53 specified alcohol or cannabis sales in town. We're just talking about alcohol sales, but they make it really clear the sales cannot take place after 9:30. Even if someone's seated at a bar, again, they would have to be served their drink before 9:30. And for retail stores that might sell, let's say, groceries and alcohol, you could continue to sell your groceries after 9:30, but alcohol sales are not allowed after 9:30. Restaurants, for example, are allowed takeout after 9:30, but you can't do takeout alcohol after that time. So really, alcohol sales must clearly stop at 9:30 or just before. And moving on to our next, our revised gathering order. This is COVID-19 order number 54. The screenshot on the left here, this little table is specific to really businesses. So this is event venues or public places. So indoors, if it's a event, so that could be a fundraiser or a birthday party or a shower, something that's truly an event, not your regular business. So it wouldn't be your regular restaurant dining. This is specific to an event where you can have no more than 25 people for an event indoors. And I'll get into our risk category, but right now, just note that the town of Northborough is currently a lower risk community. So we can host no more than 100 people under the gathering order outdoors. If we were to become a higher risk community, that would decrease to a cap of 50 individuals. And so there are additional details in this order, such as face coverings are required at all times at these public gatherings. Social distancing of at least 6 feet must take place between attendees. And again, layering that early closure, the gatherings must end and attendees must disperse by 9:30. There's also a new requirement that if you are planning an event over 50 people, and you fall under this guidance, you would need to notify the local board of health. And the reasons for that, that if we changed our risk level, we'd be able to notify you of the reduced attendance allowance if that was needed. On the right of the slide here is just occupancy limits for private residents. So people keep getting confused. Is it 10? Is it 25? So if you're at a private residence, the indoor limit all the time is no more than 10. Outdoor backyard barbecue, that sort of thing, the limit is no more than 25 individuals. And again, layering here, social distancing is required. We want face coverings to be worn by anyone if there's more than 10 people present outdoors. And then gatherings again must disperse by 9:30. People get a little confused about those numbers and, well, does that include staff or not staff? Or what if I have a family of 15? Do we have to like break into separate households? So the answer is no. So members of the same household, when you're together with no other household members, you do not constitute a gathering if you have a really big family. But again, we're talking about household members, not, your cousins from, this is all within your household. So they are not subject to a capacity limit. And workers and staff who are providing services to participants associated with a gathering don't count towards your capacity limit. So it's really, if you have an outdoor gathering, let's say in the town of Northborough, it's currently a limit of 100 outdoors, you would follow mask wearing, social distancing, but that 100 would not necessarily include staff who are serving. It's really just the number of participants. And we'll move on now to the revised face covering order. So this became effective on November 6th. It's caused quite a bit of confusion. There are some key changes here. So it's updated to say all persons over the age of 5 must wear a face mask whenever in public, indoors or outdoors. So the key thing is here is they remove that social distancing, like only if you're not able to maintain 6 feet. So that whole social distancing was taken out of the order and it did used to reside there. So we'll talk about that in the next few slides. It's important to note with this new face covering order that face coverings are required if you're in a vehicle with non-household members, if you commute with someone to work, or if you have a business and let's say it's 2 delivery guys in a vehicle, and they're not from the same household, they would need to wear the mask in the vehicle as well. It's important to note, everyone wants to know what's a public location. So on the right here, I cut and paste it straight from the order. It's any place open to the public, including without limitation, grocery stores, pharmacies, and other retail stores, public transportation or other ride-sharing vehicles, public streets and ways, and any location that hosts indoor or outdoor events, what can be considered a public location. I want you to note in particular, according to the order, there is an exception D. If sector-specific COVID-19 safety rules apply, you can defer to the mask wearing requirements under that sector-specific guidance. For example, while eating in restaurants, eating and drinking, receiving dental care or swimming, again, you would go to the COVID sector-specific guidelines related to mask wearing. That's exception D of the order. So I just want to hit this home because, again, there's a lot of questions. So what's new, what's old, what really changed in our face covering order? So where? So all public locations, and now it's even if no one is closer than 6 feet. So that's new. The carpool section, that masks or face coverings are required in carpools with non-household members is new. And the requirement for face coverings at all locations that host indoor, outdoor event performances is new. I want to go over just briefly the proof of medical exemption, the 2 new sections. It allows an employer to require documentation from employees who request an accommodation. So that's new. So if you have an employee who says, my doctor tells me I can't wear a mask, you can now require them to produce documentation showing the medical exemption. And the same goes for schools with employees and students. But you can't require, if you're a business and you're serving customers or the public, you can't require a customer to produce medical documentation. However, this last section here, deny entry, you do have some options if you're a business and you have a customer who refuses to wear a face mask. So a business can deny entry to someone who refuses to wear a face mask for non-medical reasons. And again, it's always up to a business to determine, how they want to handle it. It's important. I think the biggest thing businesses can do, it's all about signage. It's about approaching people offering masks if needed, if someone happened to forget it. And you also, as a business, have the right to offer alternative shopping methods for someone who doesn't want to wear a mask. So given that many of these businesses are, it's a private business, talk to your counsel. You can, you have different rights on how you want to, if you want to be more stringent or how you want to handle someone who's not wearing a mask. And we're going to move on to the COVID-19 travel order. I believe many of you have seen this. The website's linked at the bottom. All the states are slowly turning red. We only have a few lower risk states. So Massachusetts, Vermont, New Hampshire, and Maine are COVID-19 lower risk states as of last night. Just note that effective on November 14th, so I guess that was Saturday, District of Columbia, New York, and Washington state became red. So some new updates there. So under the COVID-19 travel order, the section on the left is taken right off that website. So it's information for employers. So you as an employer would be strongly discouraged from requiring or allowing business-related travel to non-lower risk states, as indicated right on the map. Employers that permit employer paid or reimbursed travel to these non-lower risk states should take measures to ensure your employees are complying with the travel order. And employees are also strongly urged to, you're urged to strongly discourage your employees from taking leisure travel to non-lower risk states. Okay, so here's our town's COVID-19 webpage. You have the screenshot on the right. We did make some edits over the last couple of weeks to make things more readily available to businesses and residents. So we do update our case counts weekly. The source of these updated case counts is the Massachusetts Department of Public Health's COVID-19 Weekly Public Health Report. They produce that every Thursday evening. You can see the case counts in every town, and that's where we pull our numbers. We also added a line and age cohort graph to our homepage. I'll show you those on the next slide. And we consolidated some of the information you may have seen before into really a resources for businesses webpage and a resources for residents webpage. And we added a new out-of-state travel webpage where we just conveniently link you to the state's COVID-19 travel order. We added a new COVID-19 testing webpage linking you to information about the different types of tests, how to locate a test location, et cetera, and even information on the free Stop the Spread sites that are available in this area. So here's the new line graph that's available on the town's webpage as of last week's report on 11/12. Again, the Thursday report, we had a total of 318 cases of Northborough residents or anyone living in Northborough. I produce this graph each week, and it's important. I think it's been valuable to the public to see that we are in an upward trend. You know, we're sort of bouncing around here, but our rates are increasing, or the number of new cases coming through. And we added a COVID-19 age cohort graph. So this just shows the age representation of any cases in Northborough that came in the 2-week period. That's shown in the Department of Public Health's report. And the reason we put this on the website is a lot of people say, oh, only old people get COVID, or, you know, it's really something that's just in the schools, et cetera. You know, we'll see this change a lot week by week. You can see I believe in the last 2 weekly reports, we haven't had anyone 19 and under. So, but before that we did. So it's a fluctuating number, but just realize COVID can, anyone can get COVID. And let's talk a little bit about lower risk communities. So this is the whole like community we went red, or, you know, all of that people are talking about. In Massachusetts, communities are categorized as high, moderate, or low risk. These risk levels are published weekly in the Department of Public Health's weekly public health report. The Mass Department of Public Health defines a low risk community as a city or town which has not been red in any of the following COVID weekly report. So it's clear that it's about them being consecutive. So a community will need to revert to a prior stage if we are red for 3 consecutive weeks in the report. And that rule change, if we were consecutively red for 3 reports, would become effective the Monday after the data is posted. So if, for example, if community is in the red for the 3rd week and the DPH posts the data on a Thursday, then the rules will go into effect the following Monday. And I'll talk you through what that could mean for your business. So here's really showing these 2 phases. So if as a lower risk, or right now we're listed as moderate, as a lower risk community, we're operating in phase 3, step 2. If we were to become red, we would revert to phase 3, step 1. So let's just take an example of gyms right now. If we look at the table on the left, again, this is all hyperlinked on this slide. A gym is currently operating, it's open and has a 50% capacity limit. If we were to go red for 3 consecutive weeks, the Monday following the 3rd report, that gym would need to reduce its capacity to 40%. And so this current risk level and phase, you might be a little confused because you heard Northborough went red, but now we're not red anymore. That's all because of some changes they made to the metric. So just realize that as of the most recent report on November 12th, Northborough's risk level is currently moderate. We're considered a lower risk. So anybody in gray, green, or yellow are considered lower risk, and we are operating in phase 3, step 2. So the state revised the metrics on 11/16, and we were downgraded to moderate. We were red for 1 week on 11/6, and that's because they added a new requirement now that you must have a greater than or equal to 5% positivity rates of those PCR test results coming back. And just to show you, this is overall for the state. This was from yesterday's most recent daily dashboard that's found on the mass.gov's COVID-19 page. You could just see we're seeing the numbers are really increasing. So good timing for this, good timing for us all to look at our businesses and our practices and really make sure we're doing everything we possibly can to reduce the risk of COVID, because numbers are on the rise. And this is an important step. So I'm going to jump into some frequently asked questions we received over the last few months. I queried our fabulous administrative assistants in the Board of Health office. They've been fielding questions for 6 months. I previously worked for another community, and there's some common questions that keep recurring that I'd like to cover. So let's just talk about contact tracing. So this is when we talk about, this is something the local Board of Health does with the Mass Department of Public Health and the Community Tracing Collaborative. So contact tracing is, you know, this isolation and quarantine we keep hearing about. So one question I've heard is, what do I do if an employee tells me they tested positive for COVID-19? Do I need to close my business? So again, we're going to tell you to refer to your applicable sector-specific protocols and best practices about cleaning, whether or not you need to close. Example for the schools, there's very detailed guidance documents for the schools and what they do when there's a COVID positive case. So refer to your sector-specific guidelines about cleaning. When you do have an active employee who's diagnosed, you do need diagnosed with COVID-19, you do need to perform cleaning and disinfecting. And it's really important that you encourage through your worker training all employees who test positive to disclose to you for the purposes of cleaning and disinfecting if they are positive. So as a local board of health, I won't necessarily get a positive case and call you right away and just say, Joe Smith tested positive. I hear he works there. Did he contact you? It's important that you tell your employees. If you test positive, we really need you to tell us. We want to keep everyone, all our employees and customers safe. So if you are notified of a positive case at work, the employer must notify the Board of Health. You're not going to get in trouble. We're not going to issue fines. It's just important that we are helping to keep track where our cases are originating and to see if there's any resources or additional support we can offer to you. And it's important to note that employers must assist the local Board of Health with these contact tracing efforts. And that would include advising likely contacts so we can make sure that people are isolating and self-quarantining is necessary. And testing of other workers may be recommended consistent with the guidance or the request of the local Board of Health. So it's really going to be case specific as to when someone tests positive, when they may have been infectious, and whether or not they were even at work during that infectious period. So local boards of health will help you with that. So feel free, if you find out about a positive case, you can call the local Board of Health. And we often work with the other boards of health or the CTC, wherever the positive case originated, to figure out what we need to do to keep everyone safe. So if you have an employee who has a household member who's quarantining for being in contact with a COVID-19 positive individual, the question might be, can that employee still come to work? So no answers are perfectly straightforward, but please note that household members of close contacts are not necessarily required to quarantine unless either A, they become symptomatic or the close contact test positive. So these, anyone who's a household member, again, of a close contact, they can continue to carry out normal activities as long as they're not in contact with the individual in quarantine as outlined in DPH quarantine guidance doc. So if you have a household, let's just say it's all adults, if they can separate in that household and it's just a close contact, we're not talking about a positive case, but someone was determined to be a close contact, that other adult can continue to go to work as long as they as long as they stay separated in that household. So more questions on contact tracing. So question 3, if an employee tests positive for COVID-19, when can they return to work? We get this a lot. Again, there's a general guidance of about 10 days is the typical period for isolation. So for most people, they can generally discontinue isolation after 10 days, but there's a couple clauses here. One, in the last 24 hours of the 10-day isolation, they must have improvements of symptoms. They must be fever-free without the use of fever-reducing medication. So the local Board of Health will determine that end of isolation date. And please note that no one, even a first responder, can test out of isolation. So next question, if an employee is a close contact, so an individual, again, who's within 6 feet for 15 minutes or more with a COVID-19 positive person, when can they come back to work? So again, there's never a perfectly straight answer, but in general, quarantine lasts about 14 days from the day of last exposure. So the local Board of Health will reach out to the individual, the close contact, and they will let them know the end of the quarantine period. And they'll make sure that it will typically be 14 days. The first day of your last exposure to that COVID-19 positive person is day 0. Add up 14 days, they can return on day 15, typically as long as they don't develop symptoms or come in contact with anybody else who's COVID positive or themselves test positive. And again, you cannot test out of quarantine. So while the state does advise people to be tested for COVID-19 if they were determined to be a close contact, if they show you a negative result, it doesn't mean that they can then exit quarantine. That 14 days stands regardless of a negative test result. So these reopening Massachusetts protocols, so we have some more frequently asked questions. So which reopening protocols apply to my business and how will I know if the protocols change? I think we're all struggling to keep up with the changing rules, so you're not alone. So again, we refer you to read the sector-specific guidelines for your business. Look for details in the documents and link to other documents. Like you may find that it refers you to another guidance document. So it's important to look for the details, follow the hyperlinks. And if you're not sure where what reopening protocols you should follow, you can contact your local Board of Health. The state does offer this link here where you can create a profile and sign up for COVID-19 alerts by text, email, phone, or phone call in your preferred language. So try signing up on that link. I can't guarantee how that works. It's a state resource, but I believe you'll hear about the governor's press releases, et cetera, if you sign up. So how often do we have to disinfect? And do I need to hire a professional cleaning company for my business? Is another question we are often hear. Again, I'm going to refer you to sector-specific guidelines. So they have recommendations on the frequency of cleaning. And no, you are not required to hire a professional cleaning company and under any of the state's guidance documents. And where can I find cleaning products that are effective against COVID-19? So again, refer to EPA's Enlist. You can search for cleaning products, or again, you can refer to this presentation or look on the EPA's website for CDC's website as well for using a bleach solution. So just make sure it's appropriate for the surface and you're following those directions. And lastly, what occupancy standard apply to my business? Again, I'm going to refer all businesses to review their sector-specific guidelines. And if you're planning an event, you also need to review the event standards. So also, lastly, be aware of our current risk status and step. We'll keep that updated on our resources for businesses webpage on our website. And so for a lower risk community, we're currently in phase 3, step 2, but this can change over time. So gathering order questions. So we're planning a holiday event, right? How many people can we as a business host? So again, I'm going to refer you to indoor and outdoor event standards. At private residences, events would be capped at 10 people indoors or 25 outdoors. But events at venues or public settings are capped at 25 indoors. Outdoor events are capped at 100 in these lower risk communities at this time, like Northborough, or 50 in non-lower risk communities. So do I have to notify the local board of health about an event? So yes, for gatherings over 50, if you're planning a gathering over 50 people, the operator of the venue must provide written, notice to the board of health at least 1 week prior to the event. And what's considered an event and what's regulated under this new gathering order. So this is taken straight out of the gathering document. The indoor and outdoor event standards are established are issued to establish minimum standards for any indoor outdoor events, such as a wedding, party, fundraiser, that's not specifically addressed by other sector specific safety standards. So if it's your regular business and it's covered in the sector specific guidelines, this event standard may not apply. So really refer to those sector specific guidelines. And lastly, reminder, this mandatory closing period on restrictions require now that all events cease at 9:30 and attendees must depart the premise at that time. Unless we have mask orders. So a lot of questions around masks. So do my employees have to wear masks if they're seated at their desk and they're 6 feet from others? So again, refer to the face covering order, and this is a hyperlink here. It did remove this social distancing requirement, so masks are required at all times in public settings, but please note there is a sector-specific standards reference, which is exception D, that may trump the face covering order. So again, refer to your sector-specific standards related to face coverings for your business. I would argue if it's there's certain things that are very clear, like a retail setting, a grocery store, things like that, where that face covering or mask order clearly applies, but other businesses like offices, manufacturing, et cetera, might have some slight differences they should review in their sector-specific documents. And can I ask an employer or customer to provide proof of a medical exemption for not wearing a mask? So this revised face covering order covers this topic. There is that section I mentioned earlier that allows employers and schools to require documentation for employees and students. However, that doesn't apply to customers. So a business cannot require a customer to provide documentation of a medical exemption for mask wearing. But if a customer refuses to wear a mask for non-medical reasons, the operator of that business may deny entry. As a private business, you can also offer alternatives for individuals who refuse a mask. Just this morning, I heard Costco put in a new procedure that if anyone didn't want to wear a mask, I believe they're offering face shields. So businesses can handle anyone who doesn't want to wear a mask a little differently. And so I recommend you review the face covering order. COVID-19 symptoms and travel. So if my employee has a cough, can he or she work? Again, there's no perfectly straightforward answers. I'm going to refer you to the mandatory workplace safety standards, which clearly state that employees who are displaying COVID-19 like symptoms do not report to work. So I also send everyone to the CDC's list of COVID-19 symptoms, the hyperlinks here. And again, remember that general business guidance recommends that requires that businesses establish a plan for employees getting ill from COVID at work and a return to work plan. So the schools, for example, if you have children in the schools, there's a very detailed plan of what symptoms and if you have to get a test and how you return to school. So you could look at the school's plan, talk to other businesses, but you are responsible, and it's very clear that employees who are showing these COVID-19 symptoms do not report to work. So if your employee travels to a non-lower risk state over the weekend, when can they return to work? Get ready. Thanksgiving is coming, Christmas, the holidays. So you're going to hear about employees who are traveling, and it's really important you work with these employees. So if an employee travels to a non-lower risk state, you just saw the map, he or she must quarantine for 14 days or produce a negative COVID-19 test result that was administered within 72 hours prior to arrival in Massachusetts. So again, that employee should not return to work until the test results are available. And they complete that online form. And please note the test must be a PCR test. So more details, again, can be found on the Mass COVID-19 Travel Order webpage. So I think that is it. And I'm really excited to stop talking and hand this over to Karen Chapman. So Karen is the president and CEO of Corridor 9 and 495 Regional Chamber of Commerce. So Karen, here you go. It's all you.
Thank you, Kristen. What an extensive presentation. I know that I learned a lot, especially representing a lot of employers in our region. And I want to thank you for the opportunity to be able to speak to some of our Northborough business members. If you can go to the next slide, that'd be great. So just to talk a little bit about our chamber, we are a 5-town chamber. We do represent the communities of course, Northborough here, and then Westborough, Southborough, Shrewsbury, and Grafton, with over 500 member businesses and nonprofits. The interesting news about this chamber too is that 45% of our membership does come from businesses operating outside of Northborough. So we do have a lot of members from Worcester to Boston and north and south of 495. So people join the chamber for different reasons. Number one is to really promote and network and do business with other members. We are considered the leading trusted source of information and resources for our members, and that couldn't have been more evident during the quarantine and over the last 7-8 months. It's been a hard time for business, and our job was to be key to get out information and resources that were available to businesses. And we're very fortunate because of the relationships that we have with our state and local leaders who continue to look at us to get out that information and be a conduit to our business community. And over the last month since March, especially since quarantine, the chamber, when we were in lockdown and quarantine, the chamber was a resource to our membership. And actually, because the chamber has over 20,000 contacts on our list, we continually just gave the information to anybody on our contact list to support our communities, to support anyone in business, to support residents in our community. But most importantly, in the beginning, it was all about loans, the payroll protection loans, the economic injury disaster loans, and unemployment benefits. And actually, then the next step was to how to safely reopen. We were vital resource to helping our members find PPE supplies to our local hospitals. So our community was amazing during that time when the shortage started. And there were just a lot of contacts within our community that was able to get donations of PPE supplies to our local hospitals. So the chamber was critical in contacting the region at large to ask for their support. And they certainly answered our prayers during that time and was able to provide a lot of supplies to our local hospitals. During this time, and we're continuing to do this during this time, is we're running a lot of webinars. And it's on how to run your business, how to manage a successful remote team, how to manage cash flow, networking and growing in a virtual environment. And we featured speakers to help with a lot of stress reduction because we knew that that was a big point of contention especially during quarantine and all that isolation. And we continue to run a lot of those programs to this day. Most relevant was having information sessions on the CARES Act with government leaders, and then also to have information session programs on those COVID-19 relief loans available for our small business. And also, what was very important and what we're continuing to do today is, with all the COVID-19 restrictions and guidelines, we're here to promote the businesses in our community. We're here to promote the members of our chamber. And obviously the restaurants were hit very hard. So we have continually promoted the takeout options that they provide, and if they're providing delivery. The other businesses that were very affected by this were all of our fitness facilities, and we were letting everybody know if they were open for business. They were running virtual events. Also available was childcare options that were essential for those business leaders that had to get to work, and COVID testing sites that were available during the whole time of the quarantine period, and still available to anybody that needs a resource of where to go to get testing. Relevant now, since we've opened and since some of the colder weather and things that are changing and numbers are up, this has been a big part of our initiative and continues to be part of our initiative, is how to strengthen our local economy and businesses. So the Chamber is launching and will be continuing to launch our Shop and Buy Local initiatives. We just launched a new initiative that's running from November 13th to December 18th. And we created 2 bingo cards with our partner, the local newspaper, the Community Advocate. It was printed in this week's newspaper, but most importantly, you'll see 25 different businesses located on those cards. We were encouraging the public to visit, shop, purchase. Some of our member businesses are just having you like their social media, but it's really about supporting businesses and helping them get through the next actually multiple months of while we're going to live in COVID-19 until really that vaccine is available. You'll find restaurants, fitness facility, and professional services on those cards. That's really just one of the initiatives we'll be running over the next couple of months to support local businesses. Next slide, please. So as you heard earlier, Kristen talked about a lot of the resources that are available. This is important for resources and guidance for businesses. And these are some of the information and loans that have been available or resources for business to help them get through this really crunch of what's hurting their business right now. As we all know, earlier on, the payroll protection program was available to new applicants until August 8th, and it provided a short-term loan to cover certain payroll costs, mortgage interest, rent, and utilities. Whether that'll be reopened again, we haven't received any news, but if we do, we'll be certainly promoting that information out as soon as possible. What's still available is the Economic Injury Disaster Loan, which is called the EIDL loan. The EIDL loan actually provides up to $2 million to small businesses impacted by the coronavirus shutdown. Principal and interest payments on the EIDL loan can be deferred for the first year. And right now, you can still apply for the EIDL loan until December 31st, 2020. So that's still available to businesses that might be hurting and need some economic assistance right now. All this information is on the MassGov website under COVID-19 resources and guidance for business. And the other place you should look at is COVID Relief Coalition, some good information for businesses and to find some of the information about the loans that are available. For those businesses that currently has a business relationship with a Small Business Administration Express lender, and you have access to $25,000 quickly. These loans enable small businesses that currently have a business relationship to be able to have some funds while awaiting a decision on their EIDL loan. So if you need $25,000 quickly, contact your banker, see if they are an SBA Express loan provider, lender, and see if you need money quickly. That's great access to you available right away. New that came out recently over the last month was the loans or grants, if you will, available by the Massachusetts Growth Capital Corporation, MGCC. So they're administrating small business grants. between 25,000 to 75,000. What is different about this particular grants is preference is really given to small businesses whose owners are women and minorities, veterans, members of other underrepresented groups. And these have been able to be open adversely. If your business is adversely impacted by COVID-19 pandemic, this is another avenue for small businesses to gain access for their business through the Massachusetts Growth Capital Corporation. This application actually ends tomorrow. They actually extended the application deadline because they received so many, but the deadline to apply for this application ends tomorrow at 12 o'clock. So if you're interested, I would recommend going right to the application site, which is on Massachusetts Growth Capital Corporation. And it's a great avenue to get some additional funding for your business. And then what also is available is what's called the Main Street Lending Program. And this also supports small to medium-sized businesses for-profit businesses and nonprofit organizations. But this is for the businesses that are in sound financial condition before COVID-19 hit. So, and who lack access to credit on reasonable terms. So using established lenders, the Main Street program will offer several types of 5-year loans supported by the Federal Reserve and the Treasury Department. And the money ranging there is in size from $250,000 to $300 million. So for more information, you should really visit the website on the federalreserve.gov on that particular program. And where we're most hopeful, and where I, as the chamber, is under many umbrellas, which is the U.S. Chamber umbrella, the Massachusetts Area Chamber umbrella, the New England Chamber umbrella, and chambers across the country are hoping to see the phase 4 coronavirus relief legislation get passed by the end of the year. We heard some hopeful news that was really going to happen. What I'm most hopeful about that are the areas that I've listed on this slide, is to continue to provide support for small and mid-sized employers, support for childcare, unemployment and job training, and state and local assistance. Keeping our fingers crossed, I get weekly updates from the U.S. Chamber, and that is the conversations. They are the largest advocate organization on behalf of chambers and businesses across the country to try to get the relief that's needed for our local business community. Okay, and lastly, I just want to say this. The chamber is really an advocate for small business. We're here to support our business community, whether it's loan assistance, whether it's helping them to promote and do business with one another, whether it's promoting that business is opening in that time, whether it's strengthening our local economy. So we provide a lot of avenues and programs to do that. I recommend visiting our website or reach out to me personally if I can assist you in any way. We are a membership organization. Their membership costs are low. There's different payment plans, but if you're not a business and you're interested in joining the chamber, we're happy to have more of a conversation with you. At the end of the day, even when the pandemic started, we have been offering our services available to anyone. So if you're a member or non-member, there are some different prices for non-members, but we're here to help and be here on behalf of the business community. I just talked about some of the loans and applications that are available to small businesses. We're hoping for more to come. I'm feeling pretty positive that as longer we are here sitting in a pandemic environment, more assistance is going to be needed, and we're hopefully going to be able to make that information available more by the end of the year. But that's really what the chamber's here is, to advocate for business, and happy to answer any questions about that also.
Excellent. Thank you so much, Karen. So I know we've covered a lot of information here, and what we're trying to do, as I said at the outset, is to provide this information in a user-friendly format with links that you can refer back to. All of the presentation and all the links are on our webpage. And again, we're trying to make contacts for you. So on some of these potential business loans or opportunities, The chamber is your best source of information, and I highly encourage you, if you're not a member of the Chamber of Commerce, they're the primary arm of the town when it comes to meeting the needs and working with our local business, our local businesses. They do a fantastic job, and I strongly encourage you to take advantage of the resources that they have available. In terms of the Board of Health and lots of questions, Kristen covered a lot of information. And if you take nothing else away from today, it's that it's confusing. And every time I ask Kristen a question, probably half the time or greater, the response is, it depends. And because of that response, it depends, it means you need to seek the information and clarification, much and most of which the Board of Health can help you with, at least get you pointed in the right direction. If we get too far down into the weeds on something really specific to your business, you may need to get some legal counsel with regard to your specific situation. But by and large, the general information that is available out there and that you would need as a local business is available through the links in this presentation. So I encourage you to refer back to it. Again, it's available on the COVID-19 webpage of the town. On the top left-hand side is the link to the presentation. Now, we allotted about an hour and a half for this workshop in total. So we do have some questions that have appeared in the Q&A. The intention is to take the questions that we've received through the Q&A first, and they seem mostly directed toward Kristen. So I'm going to allow her to go through those, and then we'll open it up to any folks that are still on the call with a live question. Yeah, you can certainly click raise your hand, and we'll take those in order of receipt. So with that, I'm going to refer it back to Kristen. Kristen, you want to go through the questions that you've received on the Q&A? Many of these have been answered, but certainly you can follow up.
Sure. So thank you very much, and great job, Karen. It was great hearing the research. I'm glad you're handling the difficult financial stuff for businesses, because that's well beyond my understanding. So thank you for joining us. So again, I'm going to just quickly, I'm going to pull up here, I'll leave the slide up here with our contact information as I work through these questions. So we will stop the screen share in a minute. So if you want to take notes of phone numbers or email addresses, please do so on the screen. So I'm just going to work through quickly the Q&A before we hand it over to our moderator, Chief Parenti, and he'll take any raised hands. So it looked like Barbara had a really specific question about a possible exposure and when employees work. So all of those are really case specific. And Barbara, I'm happy if you could give me a ring after this call and I'll talk you through that. And the reason it's never a slam dunk, and it all depends on like when a person was exposed and when they were infectious and were they symptomatic, when was their test. So that gets really really specific, and I'm happy to talk you through that and point you in the right direction. So Tracy asked a question about contact tracing and noted that her company does contact tracing. So if we have a positive case, does the Board of Health also conduct contact tracing? So contact tracing, you know, there is some overlap between businesses. I mean, we're working very closely with the schools and they have the list, they know who was in contact. So it is it's a joint relationship. At the end of the day, if someone's a close contact, we actually enter that into the system called Maven that local boards of health have access to. So where we can see the positive cases, we can link their close contacts and we can document clusters. So yes, we would, while companies may be doing contact tracing and really figuring out who was, you know, or keeping seating charts or work lists of who is in rooms, that's a very important part, but it's a partnership. So we will, or local board of health related to the positive case, would work with you on that. Let me just see what other questions we have here. So another question from Tracy: if someone traveled to a high-risk state, can they get tested upon the return for clearance? So yes, so the COVID-19 travel order on the state's website does allow for individuals to receive, to be tested within 72 hours prior to arrival or upon return. And so, and if they get tested to test out of that quarantine, that's great. They would just need to stay home and quarantine until they get that negative test result. So as we know, there may be a 2-3 day 2-day delay. Or I even recommend people, Massachusetts has pretty good access to testing. If you come back to Massachusetts, you can, some of the Stop the Spread sites, you can make an appointment in advance, have the appointment, get tested as soon as you can, and then await the results at home. Once you have a negative test result, you would be allowed to return to work. Here's another questions about surgical masks and whether or not someone was wearing a surgical mask. Are they still a close contact? So masks are great. They reduce the risk of transmission greatly, but they don't really play a role in when we determine a close contact. So I could tell you if I was with a known COVID-19 positive person, they were wearing an N95, I'd feel a lot safer, but there's still, I could still be a contact. So mask wearing isn't really playing into that necessarily. Millie has a question here about holidays and school vacations coming and whether or not with this expected rise we're hearing and we're seeing across the nation, are there any discussions regarding moving back to even a more restrictive phase? We're seeing that in other states. We're definitely, I think that's playing through all of our minds right now, especially for businesses. And so unfortunately, no crystal ball here, wish I had it, Millie, but we're just all at the same mercy of just waiting for the next press release from the governor. So again, the goal is if we all do our part, we'll help to reduce transmission, improve our chances of staying open or allowing businesses to open, but no crystal ball. Okay, I got a couple longer questions. Let me try to quickly peruse if there are discussions regarding, there's a more specific question here from Millie. Maybe we could touch base after this about specific holiday gatherings, etc. So I'll touch base with you after. Millie, feel free to give me a call. Rita has a question here regarding the 72 hours. So what if 4 to 5 days of returning, they actually come down with it? Shouldn't they retest? It's the safest way. So that COVID-19 travel order, I don't love it, okay? Like, I think if we all think about you go to a high risk state, you could, you know, and the rule says you can get a test within 72 hours. Well, you could have picked it up on your last day and you could have been tested the day before. So yeah, we're gonna miss some things there. So it's really important whether you get a test that day, if you are showing any symptoms, even if you just got a negative test the day before, it's really important you call your doctor or your employee would refer to their doctor. You know, testing is not a slam dunk. There can be issues with it. So at the end of the day with the COVID-19 travel order, you know, we just have to pass that straight test phase of did they follow the order, you know? And so if they did follow the order, yes, they can come back. Is there a chance that they could have picked it up on their last day and they tested right away and we didn't see it because it could take 4 to 5 days for COVID symptoms to develop or that test to show up positive? So it's not a perfect system, but the order is the order. So I defer to follow that and exercise caution with monitoring for symptoms, etc. And then Diana has a question about funding questions. She says she's tried to apply for funds for a month. So I'm going to refer that question to Karen. And Diana, if you want to give a call to Karen after, her phone number's on the screen here. I think she'll hopefully be able to talk you through that process. And I'm really glad to have Karen here to support our businesses. So thank you.
Excellent. So we're shifting gears now. Those folks that are still participating, if you would like to ask a question live, if you want to raise your hand, you can take those.
We do have one question, one hand up. Also, if you're on your phone, *9 will raise your hand as well. So Diane, I'm going to let you in here. Hang on a second. Go ahead, Diane, you're live. Diana?
She may have gotten her question answered on the
I can still hear it.
on the Q&A. So
yeah.
Okay.
That is the only hand I see right now. Oh,
Okay.
I went down here. Hang on, just popped up. Rita, hang on a second. And unmute yourself, Rita, and go ahead.
Yep. Hi, everybody. Thanks again. All this information is fantastic. So regarding this testing employees, And the fact that, yeah, it seems more prudent, someone, comes back from vacation or something like that. They get tested within that 72 hours, then it almost seems prudent to wait, 3 or 4 days. So it's like negative test plus quarantining plus another test. Is there a list of places that I can send my people? Because that could get expensive, or can I think there are places that I can send them. So in Massachusetts, without having to pay for that PCR test.
So I'll grab that question, Rita. That's a great question. So again, you as a business, you can set rules that are stricter than the COVID-19 travel order. Obviously, you can't sit there and say, you can't take away the state's order, but I know the schools in Northborough, for example, have been more restrictive. They're not allowing students and staff to test out of the 14-day quarantine. So realize you as a private business, you have some flexibility there. So I understand you want to encourage employees to be tested, maybe even more than once. So the state does offer free stop the spread sites. The closest, I believe, we have Marlborough, Worcester, Framingham. Those stop the spread sites are totally free. They are PCR tests, which is that gold standard. We definitely recommend that people would avoid antigen tests. If you have a positive antigen, you still need to then go get a PCR. So we just want people to go get the best test right away and know for sure. We're seeing turnaround times of 24 to 48 hours on average. So again, those stop the spread sites, they're linked on our town's webpage. Again, that COVID page is a COVID-19 testing webpage. And so some of them you make appointments, some of them are walk-in. They're all a little different, but they cost $0. You don't have to show your insurance card, etc. You always can contact your primary care professional. So your PCP can order a test for you, but some insurances I've heard, again, I'm not on the insurance billing end. I have heard from some people, if you're not symptomatic, the insurance company may not cover the cost of the test. Right. I've also heard some of these like pharmacy or private testing locations charge up to $160, $180 a test. So, testing can be expensive. Luckily, we're in Massachusetts, and I think I consider ourselves fortunate. We have good access to testing. So I recommend people to refer to those stop the spread sites for testing if they're looking for free testing. And I hope that answered your question.
It did. It's excellent. And I'll definitely put in my own sort of more stricter things because it just makes more sense to me. While I have my hand up, can I ask one more question? And that's regarding the outdoor mask, because of course I have spin classes outside where it's heavy cardiovascular, but they're real, we're really very spread out. And I just wanted to have an abundance of caution there. And what I read on the step 3, phase 3, step 2, under adult amateur sports related, which I believe was the right section, and now I'll refer to those other sections, is that if we had previous guidelines in place, that we can use those. So in fact, I'm actually having, people, we're separating them probably even more, but also once they get to their mat or their bike, they can remove their mask.
So it's tricky with the mask. All that sport guidance is brand new. There's also a section, if you go to the additional guidance on the state websites under youth and amateur sports, you can actually submit a question straight to the state. But I believe it's very clearly specified with classes whether or not they can wear a mask. So if you made your own rules or your own protocols and procedures before, that's great. But you need to meet the state's requirements. So you can't be any less restrictive.
No.
So if the state's classes say that you must wear a mask during all classes, then you must wear a mask. They did just make another change last week that would lower risk or activities if they're 14 feet apart. I believe you're allowed to take the mask off again. So again, I don't want to speak too much to those particular guidance docs, but I'd refer you to review them. The newest ones that are posted to the website, and call me if you have questions after, and I can always run it up the chain. How we implement these guidance docs can become very confusing, and I always go straight to the state.
Perfect. Thank you so much, Kristen. You've been so helpful.
Okay, once again, if you have a question, please hit the raise your hand button. If you're on a phone, you have a question, hit *9.
And just again, keeping in mind, you may have a very specific question to you or an employee, and obviously we want to be careful not to engage in any HIPAA violations here. So if you do have a detailed specific question, I encourage you to take it offline. Again, up on the screen is the contact information for Kristen Black, our health agent, and any business related questions. We've got Karen Chapman from the Corridor 9, and two great resources, and they're very happy to help folks. I'm not seeing any other hands up. So I think at this point, we'll going once, going twice. Okay. This, as we all know, is not going to be over today with this presentation. The rules, the guidance, the situation is constantly evolving, so we encourage you to stay engaged. Again, our website and the information that Kristen has put up there, some of which is specific to Northborough, most of which defers to the state in terms of their guidelines and advisories. We will continue to keep that information up to date. And if you feel like this workshop was helpful to you, and if things change sufficiently moving forward and you'd like to see us do something like this again, by all means, reach out to our office. You can reach out to Kristen or my office. Let us know if you think this is something you'd like to do again, and we're happy to do this. For us, it's all about communication, making resources available, and ultimately, the whole point of this entire exercise is to keep you safe, keep your employees safe, and to keep your customers safe, and ultimately keep you in business. So that's what we're trying to do, and to do that safely. So with that, unless any panelists have any other final parting comments, we're going to close this workshop, reminding everybody it is available, fully recorded. It'll be available on the website along with Kristen and Karen's presentations. And you can certainly follow up with any other questions that you have following this workshop. So thank you for attending, and we appreciate your attention. Thank you.